Hey, Jackie. Okay, let's get this party started. Let me see if I can, Sorry guys, I'm trying to get my my window set up here. Okay. Now, let me just share my screen. Okay, are you guys able to see my screen? Hey, Nikki, hope you're doing well. Oh, hey, Cheryl. Okay, you guys are all here. Well, so today is going to be a little different. Today we're actually not going to have an actual specific lesson. Today is going to be all questions. So we're going to be doing all questions for the entire time. You had certain assigned readings for this week, chapters 63, 67, 68. So ophthalmology services, respiratory care services, and surgical services. So we're going to have some questions and some general review questions. So practice exam 2 is coming up. So I'm hoping to do this general review to kind of give you guys an idea of concepts and things that we've gone over. So I hope you guys all had a great Halloween. I dressed up my dogs, so it was great. All right, let's get started. So for chapter 63, and we're going to be diving right on in to all the questions, is ophthalmology services. And I feel that you do have some questions from this chapter on the exam, and it's just important to essentially know this information. So, question 1. A patient who underwent intraocular surgery was diagnosed with a non-infectious endophthalmitis after the procedure. The IP initiates an investigation to identify the possible cause. Which of the following factors should be considered? 1. Improper handling, cleaning, and rinsing of the instruments. 2. Improper labeling of the solutions. 3. Gloves and powder. And 4. Prophylactic antibiotics administered 2 hours after the procedure. Okay, so we have a variety of different answers. We have a lot of A's, some B's, and a C. Okay, so let's see what the correct answer is. The correct answer is A, 1 and 3. So improper handling, cleaning, and rinsing of the instruments, and gloves and powder, not improper labeling of the solution or prophylactic antibiotics administered 2 hours after the procedure. So let's look at the rationale. Endophthalmitis is an inflammatory condition of the intraocular cavities, usually caused by infection. Non-infectious endophthalmitis may result from various causes, such as retained native lens material after an operation or from toxic agents. Improper cleaning and rinsing of surgical instruments can leave a residue, which can irritate the eye and cause inflammation. Gloves, especially those with powder, can also cause inflammation of the eye during surgery. Question 2. Non-infectious postoperative endophthalmitis is most often associated with A. Wearing contact lenses, B. Toxic anterior segment syndrome, C. Conjunctivitis, and D. Keratitis. Okay, so this is pretty much a mixed bag. We have some B's, some A's, some C's, and some D's. So we have all the answers were selected. um, okay, so let's see. Can anybody on the call tell us what keratitis is? You can type yes, and then I'll unmute your line. Or maybe what or what toxic anterior segment syndrome is. Let's see. Do we have any volunteers? Anybody who completed their readings? No volunteers? Okay. Okay, well, let's read the rationale. I was hoping we'd be able to kind of work through it together, but let's look at what the APIC text tells us. The correct answer is toxic anterior segment syndrome. And the rationale is healthcare-associated endophthalmitis can be either non-infectious or infectious. Non-infectious endophthalmitis is an adverse event with several presenting causes, including retained lens material and other introduced toxic substances. Frequency is unknown, but occurrence is not rare. Non-infectious postoperative endophthalmitis is most often associated with TASS, an acute rapid onset of which is toxic anterior segment syndrome, an acute rapid onset of sterile anterior segment inflammation that mimics infectious endophthalmitis. Outbreaks of TASS have been associated with breaches in handling, cleaning, and disinfecting surgical instruments, introduction of contaminated solutions, contaminated intraocular lenses, and toxic medications during surgery, powder from gloves, and irritants like dried blood, endotoxins, or residual detergent left on instruments. So some of the key points is that they really want you to understand the differences between infectious and non-infectious endophthalmitis, and then what some of those causes may be. So in the previous question that we had, where it was giving you multiple options of what the correct answer could be, like powder from gloves or contaminated solution. Sorry, no, it was incorrectly labeled solution. What they're really looking for is these facts right here: the cleaning and disinfecting of surgical instruments, introduction of contaminated solutions, contaminated intraocular lenses, and toxic medications during surgery. So they're wanting for you to have a basic understanding of what kind of things you should be looking for if you're having these types of cases in your facility. So it seems like a very specific question or a very specific topic, but that is what the APIC text is there for. Like, it's a resource for you to utilize when you have these really kind of odd questions related to infection control coming up in the facility, and also just ensuring that you have a resource which will be able to tell you the appropriate steps to take specifically relating to infection control. Okay, question 3. Epidemic keratoconjunctivitis is a viral conjunctivitis caused by a group of adenoviruses. EKC is highly contagious and can be problematic in ambulatory surgery settings. Recommended measures for control of these infections include 1. Disinfection of tonometer tip in 3% hydrogen peroxide. 2. Sterilize ophthalmoscopes between uses. 3. Disinfection of the environment. And 4. Frequent hand hygiene. Interesting. Okay, so let's go ahead and look at some of our answer choices. We have a variety of options, but I think there's one that we can cross out immediately. And I'll go ahead and, the correct answers are 1, 3, and 4. And so we can cross out number 2 immediately. Why? Why is this not an option that we should be looking at? Correct, Nikki and Bethany. It does not require sterilization. So we utilize the Spalding criteria, right, to basically place different types of medical equipment, to categorize them. What are the 3 different categories for the Spalding criteria? So we have 3 categories. Sorry, guys, I cannot write with a mouse, right? So we have critical, semi-critical. Oh my goodness, this is such horrible writing. Yes, I'm so sorry, guys. I can't write with this mouse. So yeah, so we have non-critical, semi-critical, and critical, right? So your Spalding criteria is going to help you essentially determine what type of cleaning or sterilization your devices need, right? So for example, an endoscope. An endoscope. So if you work in an endoscopy unit, what criteria would it fall under? And let me see if I can pull up Spalding criteria on the side. Because you guys, it seems like Spalding criteria. Let me see if I can pull this up and just show you guys Spalding criteria. Let's see what this is. Okay, so we have critical, semi-critical, and non-critical. And it gives you the definition of what kind of contact it has with the person. So for critical equipment, it's a device that enters sterile tissue, including the vascular system, cleaning followed by sterilization. Examples are going to be surgical instruments, implants, biopsy instruments, foot care instruments, eye and dental equipment. Semi-critical are equipment devices that come into contact with non-intact skin or mucous membranes, but does not penetrate them. And it's cleaning followed by high-level disinfection as a minimum. Sterilization is preferred. Respiratory therapy equipment, anesthesia equipment, tonometer. And then the last one is non-critical. Equipment devices that touch only intact skin and not mucous membranes, or does not directly touch the patient, does not touch the client, patient, or resident, and this is cleaned by low-level disinfection like EKG machines, oximeters, bedpans, urinals, and commodes. So based on that, where would ophthalmoscopes lie? Would they be considered critical devices, semi-critical, non-critical? So we seem to think, some people think that they're semi-critical, and some people think that they are non-critical. Okay, well, let's Google this. Non-critical versus semi-critical Spalding. Okay, let's see. I'm thinking that it's non-critical, but I'm not 100% sure. Okay, well, we do know, sorry, you know, I don't know everything. I am not an encyclopedia, but I would think that it's non-critical, and we know that it's not necessarily to sterilize non-critical or semi-critical equipment. And your endoscopes are going to be semi-critical equipment because they are coming into contact with mucous membranes. So you're going to want to perform high-level disinfection. So when you're reading through answers like this, yes. So there is a lot of information here about epidemic keratoconjunctivitis, but do you see how you coming up with the appropriate answer doesn't actually require you knowing what that is? It doesn't actually require you knowing what epidemic keratoconjunctivitis is. It requires you knowing what to rule out. So remember that when you're answering questions. Sorry, we spent a lot of time on that. Okay, let's do, sorry, there were no questions for chapter 67. So for chapter 68, surgical services, question 1 is, which of the following scenarios would be most appropriate for immediate use sterilization? A, the vendor brings the instrument for the procedure the morning of the surgery, which does not allow for the full sterilization process. B, the instrument used for the procedure is dropped on the floor of the operating room and another instrument is not available. C, the turnaround time between procedures does not allow enough time for the full sterilization process. Or D, the OR does not have the needed instruments to meet the demand of surgeries, so the instruments are flashed between procedures. Okay, that last one has me shook. I can't. Okay, so we have a variety of answers. We have a lot of B's, some C's, and an A. Yeah, so it's definitely it's definitely not D. D has me concerned. But let's look. Okay, so do we have an IP on the line who would feel comfortable? Let me pick someone who got the correct answer. Um, okay, let's see. Oh, Nikki didn't participate in this one. Okay. What about Melody Miller? Let's see if I can unmute your line, Melody, because you selected the correct answer. So if you could just walk us through your thought process, that would be really helpful. Hey, Melody. Hello. No, oh, she's not on the line. Okay, well, the correct answer is B, which is what she selected. Um, she chose B, which is the instrument used for the procedure is dropped on the floor of the operating room, and that other instrument is not available. So I really wanted, the issue is, for some of these questions specifically relating to sterilization and dealing with the OR, we do have a lot of epidemiologists on the line that may not be coming into contact or that may not be working healthcare-associated infection outbreaks often to where they would be exposed to operating rooms. I know UIP's on the line. You guys deal with this on a regular basis, so I felt like maybe it would be a good idea. It would be a good idea for you guys to talk about it, but maybe you guys can type about it. So Melody says, you always have vendors bring in the night before. It is unacceptable to bring in the morning of. Okay, so that is some experience there. And the turnaround time between procedure does not allow for enough time for the full sterilization process. That is also just not an acceptable answer. Turnaround time is unacceptable. More instruments should be purchased correctly. So Cheryl says, one rationale, if the patient is open and on the table, the instrument is needed for flash sterilization. So flash sterilization is a quick steam sterilization cycle that does not use the full sterilization cycle of exposure and dry times. Exposure may be abbreviated in gravity steam sterilizers by eliminating wrapping material or using container systems that ensure that the steam has unrestricted access to the instruments. The Association of Perioperative Registered Nurses recommended practices are consistent with the Association of Advancement in Medical Instrumentation, AMI, which recommended that flash sterilization should be used only when there is an urgent need for the items. Question 2. An IP conducts an audit of the OR cleaning process. The action that would be most concerning would be A. The OR is terminally cleaned at the end of each business day. B. The decontamination process starts on the floor of the OR and works upwards towards the lighting. C. The cleaning solutions are prepared daily. And D. A wet vacuum and microfiber mop head are used to clean the OR floors. Okay, you guys are all putting, you guys, like literally everyone, almost everyone put B. The decontamination process starts on the floor of the OR and works upwards towards the lighting. So this is most definitely incorrect. This would be the most concerning. And it does, so they do talk about this in chapter 68, but and also in another chapter where they mention this is chapter 107 for environmental services. So when it comes to proper cleaning and disinfection of healthcare environments, one thing that the APIC text does always point out is the importance of cleaning from cleanest to dirtiest and then from high to low. You don't want to clean an entire room and then dust the room, because when you're dusting, those particles are falling down so that you're able to pick them up and so that you're actually able to clean up. So you do not want to start cleaning and disinfecting that OR and then moving up towards the lighting, like dusting the lighting, because then all of those dust particles that could contain microbes or that could contain pathogens are falling back down into your clean surface. So you always remember you clean from cleanest to dirtiest and then from high to low or top to bottom. Okay? And this is great. Cleaning solutions should be prepared daily. Um, a wet vacuum and microfiber mop head are used to clean the OR. Absolutely perfectly fine. The OR is terminally cleaned at the end of each business day. That is totally acceptable. So, as you know, microfiber cloths and microfiber mops are considered the gold standard for infection prevention and control per CDC guidelines. Okay, now it's time for our general review. So this is really going to be over the last weeks that we've been together in our group. So it's going to contain a variety of chapters. It's not just going to come from the 3 chapters that you were assigned this week. So question 1, which of the following specimens can remain at room temperature after collection if transport to the lab will be delayed? A, sputum, B, urine, C, stool, D, cerebrospinal fluid. So the majority of my epis got this one right. Good job. Carrie, Nadia, Stephanie, Gina. The correct answer is cerebral spinal fluid. You guys have to know this. You have to know these. There is just, you got to know it. Cerebral spinal fluid should be transported to the laboratory immediately after collection if possible. If this is not possible, then it should be maintained at room temperature and transported within 1 hour. So let's review. Urine, refrigeration or room temp? You can put F for fridge, R for room temperature. Okay. Most people put refrigeration. Cerebrospinal fluid. Yes, we just did this one, so you guys all better put R or we're gonna have problems. Room temp, correct. Next is your cute little stool sample here. Do you keep that at room temperature or refrigeration? F for fridge, R for room temp. Refrigerate. Next, that is a lovely sputum sample that you have there. Do you refrigerate it or you leave that at room temp? You refrigerate it. Next, we have a genital sample. Room temp or refrigeration situation station. Room temp. And then lastly, eye specimens, eye fluid, eye things, eyeballs. Okay, so we have, okay, this one's kind of mixed. We have some room temperatures. We have some people who think it should be in the fridge. Room temp. Okay, guys, you need to make some flashcards. I don't know what you guys need to do, but you gotta know this. You need to know this slide right here. You need to know this for the test. Okay, question 2. According to the Centers for Disease Control and Prevention Infection Control Guidelines, routine microbiological sampling is indicated for which of the following? A. Respiratory therapy equipment. B. Sterile disposal equipment. C. Dialysis fluid. D. Operating room surfaces. So they are asking about routine microbiological sampling. Okay, we have the majority of you put down C, which is correct. Very good. Yes, dialysis. Dialysis fluid should be tested. Why? It's great that you know that it should be tested, but why? What are you concerned with when it comes to dialysis? What do you always want to do microbiological sampling? We have some microbial growth. We have Hep B, contamination of patient's blood. Melody. Melody, you are so good. That's exactly what I was thinking. Endotoxins. Correct. Yes. So in your dialysis chapter of the APIC text, they do talk about, and it gets real complicated because they talk a lot about like the water flow, the type of it's intense. Dialysis, let me tell you, dialysis is something else. That chapter is really great, but they do talk to you about the importance of doing microbiological sampling of the water. Yes, you're concerned about microbial growth, you're concerned about endotoxins, so you do need to make sure that you're sampling that dialysis fluid. Microbiological sampling of air, water, and inanimate sampling is an expensive and time-consuming process and is not routinely recommended. Routine microbiological sampling is indicated. However, for quality assurance purposes, such as monthly culturing, routine microbiological sampling is not indicated for, wait, what? Routine microbiological sampling is indicated, however, for quality assurance purposes, such as monthly culturing of water used in hemodialysis applications and for the final dialysate dilution. Okay, so this is the important part. Monthly culturing of water used in hemodialysis applications and for the final dialysate used dilution. So I do copy these rationales straight from the APIC text, guys. So I think I might have missed a word here. I'm sorry. Okay, so question 3. DMAIC refers to a data-driven quality strategy for improving process and is an integral part of the Six Sigma quality initiative. The DMAIC format includes all of these except A, measure the performance of the process involved. B, define the customer project boundaries and improvement process. C, improve the target process by designing creative solutions to fix and prevent problems. D, control the improvements only until problems are no longer prevalent. The DMAIC format includes all of these except. Okay, the majority of you put D for this one, which is correct. Okay, can anybody tell me what the D in DMAIC stands for? Very good, Gina. Define. What about the M? Very good, Carrie. Measure. The A? Good job, Carrie. Analyze. I? Improve. Good job, Jackie Perez. And then the last one is C. Infection control. Okay. Good job, Stephanie. Yes. So the DMAIC, an abbreviation for define, measure, analyze, improve, and control, refers to a data-driven improvement cycle used for improving, optimizing, and stabilizing business processes and designs. The DMAIC improvement cycle is the core tool used to drive Six Sigma projects. The purpose of control step is to sustain the gains of the process and to monitor the improvements to ensure continued and sustainable success. So this is from chapter 16 of Quality Concepts. Question 4. The NICU medical director has requested the NICU nosocomial infection rate for bloodstream infections. He wants baseline data and asks you to design and implement a hand washing campaign using the BSI rate as one of the outcome indicators. He wants these data presented to the performance improvement program. In the NICU, what information do you need to best risk stratify data? Risk stratify data. Okay, so let's see what kind of answers we have here. The majority of you put C. We have some B's. We have, there's an A. So the correct answer is birth weight. Now, this is going to come straight out of chapter 15 with the risk adjusted comparisons. Stratification is a form of risk adjustment that involves classifying data into subgroups based on one of more characteristics. It is common for patients in the neonatal ICU to be stratified by birth weight categories as follows. So this is from chapter 15, risk adjusted comparisons. And that's from module 2, right? Gotta know this. Okay, question 5. Which of the following is true about sampling of water and dialysate in dialysis? Oh, interesting. A, sampling should be carried out annually. B, results from sampling might not accurately reflect the levels of microbes in the water or dialysate. C, blood agar may be used as a growth medium. And D, a calibrated loop may be used to inoculate spread plates. Give you some time there. Okay, so we have every answer selected. Everyone chose C, B, A, D. Everybody chose everything. So this is one that we're not sure of. Okay. Results from sampling might not accurately reflect the levels of microbes in the water or dialysate. You should have been able to cross out A because we already know that we need to do monthly testing. We saw that recommendation in our previous answer. Okay, so you should have been able to cross out A immediately. So water and dialysate used for dialysis must be treated properly and should be tested at least monthly, right? Okay, so we know this. We learned at least something today. We learn a lot of things every day, but dialysis. To prevent infections or other complications due to the presence of microbes in system water. The Association for the Advancement of Medical Instrumentation, AMI, sets standards for testing water and dialysate in dialysis settings. Testing may be carried out by the membrane filter technique or by spread plates. Test results can be used to drive decisions about disinfection schedules, but because bacteria may exist in biofilms and therefore be difficult to isolate in dialysis systems, the test results may not be an accurate measure of the true level of microbes in the system. And so this is coming from the 2003 Guidelines for Environmental Infection Control in Healthcare Facilities. This is actually a document that I quote all the time. It's a pretty lengthy document, but they have a lot of really great guidelines, specifically when you're conducting infection control assessments in acute care hospitals. Um, it provides it with a lot of really good resources and recommendations that you're able to discuss with the facility. So I would definitely recommend that being a resource for all of you. For those of you who've never even just browsed through it, it would be really helpful. Okay, question 6. A gram-negative bacterium responsible for chronic gastritis and a major factor in peptic ulcer disease is antral gastritis, or in español, gastritis. Okay, antral gastritis is an inflammation of the antral portion of the stomach, which probably begins in the mucosa, usually involves the submucosa, and may even extend to the serosa, all the osas. All right, guys. So you got to know this one, Helicobacter pylori. The correct answer is Helicobacter pylori, and the key here being peptic ulcer disease. Helicobacter pylori is a spiral-shaped bacterium that is found in the gastric mucus layer or adherent to the epithelial lining of the stomach. H. pylori causes more than 90% of duodenal ulcers and up to 80% of gastric ulcers. Question 7. Your patient has a low absolute neutrophil count. Of the following choices, which is true of your patients? 1. They are especially susceptible to disease. 2. You can determine the absolute neutrophil count by multiplying the total white blood cell count by the percentage of mature and immature neutrophils. 3. The patient's white blood cell count is between 4,000 and 10,000. 4. The patient's complement system will only be activated through the alternative pathway. You guys, the CIC exam loves questions like this, so okay, let's see what. Okay, um, I apologize. This should have been A, B, or C. Okay, so we have, let's see. There's a lot of ones. I think the ones are winning. Some people are stuck between 1 or 4. Oh, the ones won. The ones won. Very good. So they're telling us the true are 1 and 2. The patient's white blood cell count is between 4,000 and 10,000. That does not seem like they would be. Does anyone know what a low neutrophil count would be if it falls below what? Do I have any nurses on the line? Any physicians on the line who are looking at labs all day, every day? Because I know when I was a scribe in the ER, I know we would grow really concerned once that white blood cell count would climb over like the 12,000 range. So I think the normal range must be somewhere probably between what? Maybe this is the normal range, 4,000 to 10,000, even though I think it might be 11,000. Okay. So let's read our rationale. An absolute neutrophil count, ANC, is defined as the real number of white blood cells that are neutrophils. The ANC is not measured directly. It is derived by multiplying the white blood cell count times the percent of neutrophils in the differential white blood cell count. The percent of neutrophils consists of the segmented, fully mature neutrophils and the bands, almost mature neutrophils. The normal range for the ANC equals 1.5 to 8.0, 1,500 to 8,000. Neutrophils are key components in the system of defense against infection. An absence or scarcity of neutrophils makes a person vulnerable to infection. And this is from Chapter 22, Microbial Pathogenicity and Host Response. Oh, I was talking Michelle, I was talking specifically about white blood cell counts. I apologize if I didn't make that clear when I was asking about the range. I don't know if I said neutrophil. I meant white blood cell. I'm sorry. Okay. Question 8. Microorganisms are grown on culture media made of an agar base. Additive to the media vary according to the growth requirements of the organism and or the desire to select out a specific organism. Fastidious organisms require blank media, and blank media is used to inhibit normal commensals. I'm sure some of you are like, oh, I should know this. Yes, you should. Okay, let's see who the winning answer is. So we have a lot of B's. The majority of answers are B's. There are some A's and some D's, but the majority of you are saying B. Can anybody tell me what a fastidious organism is? Are those easy to grow or hard to grow? Difficult to grow. Very good. And yay, you guys mostly put B. B, 2 and 3. Yes, difficult to grow. Fastidious organisms are difficult to grow. So fastidious organisms require enriched media, and selective media is used to inhibit normal commensals. So can anyone tell me what nutrient agar? Give me an example of a nutrient agar and what is it used for? I know you guys had microbiome and we went over this before. You gotta know your different types of media. Okay, so for nutrient agar, it supports the growth of a wide variety of bacteria. And an example would be your trypticase soy agar or TSA with sheep's blood. Now, what about enrichment medium? What is enrichment media? Crickets. Okay. Guys, you got to know your media. It contains special nutrients necessary for the growth of fastidious bacteria. Chocolate agar, which is utilized for the growth of Neisseria meningitidis. What about selective? Selective media. Okay, it contains chemicals or antibiotics designed to inhibit normal commensal bacteria, like bismuth sulfate agar for the isolation of Salmonella species. And then lastly, our differential media. They stain colonies of specific organisms while inhibiting the growth of others. Acetate agar to differentiate between E. coli from Shigella. So I know it's not always the easiest, specifically when it comes to dealing with lab things, but it's really important that you make some study cards or that you find a way that helps you remember this. So I don't know if for enrichment medium, because they're difficult to grow, you have to give them extra goodies. You have to come up with different ways for you to basically be able to remember these different types of media, because it's really helpful for the exam, but it should also be kind of understood in general. All right, we have a case study. So, 36-year-old man presented to the emergency department with a 2-week history of fever, headache, drowsiness, and photophobia. He was previously healthy and was sexually active with men. The physical examination was notable for a temperature of 38.3 degrees Celsius and neck stiffness. Computed tomography of the head was normal. The opening pressure on the lumbar puncture was 29 cm of water. The cerebral spinal fluid cell count was 340 cells per microliter with 90% mononuclear cells, which were predominantly lymphocytes. The glucose level was 46 milligrams per deciliter, and the protein level was 0.80 grams per liter. 0.15 to, oh wait, what? Oh, sorry, that was the reference range. Sorry. The gram stain, which is panel A, this panel, and India ink, panel B, the panel on this side, revealed abundant encapsulated round yeast with some budding forms. What pathogen do you suspect? There's a lot of clinical information in this case study. Oh, wow. Melody, Liza, Cheryl, Sarah. Wow, you guys are just, I am totally blown away. Very good, guys. Very, very good. I'll give you guys another second to think about it. Okay, so some key things I want you to know here. I actually took this from a New England journal. It's an actual paper you're able to go and read a little bit more about. So things that they're talking about here, they're giving you symptomology, how the patient is presenting. You should be really concerned when you're seeing neck stiffness, right? What is that a sign of? When you have someone coming in with photophobia and neck stiffness, something should literally right in the differential, very top, meningitis. Very good, everybody. So additionally, they're telling you about what the CSF looks like. And I've told you guys before, I'm not a doctor, I'm not a nurse, so I'm not always the best at explaining some of the clinical concepts, but it is very important for you to be familiar with that table in your APIC text, which goes over what you should look for in CSF to determine whether it's a viral, fungal, bacterial infection. You need to be familiar with that. And, I can only cover it so many times, but you really have to go over it in order to solidify it. And then the last clue being abundant encapsulated round yeast. So we know it's not Neisseria meningitidis because Neisseria meningitidis is not a yeast. The correct answer, like the majority of the names I called out earlier, was Cryptococcus neoformans. So Cryptococcus neoformans is a fungus that lives in the environment throughout the world. People can become infected with C. neoformans after breathing in the microscopic fungus, although most people who are exposed to the fungus never get sick from it. And this is an image from the CDC. So let's do some fast facts about Cryptococcus neoformans. So infections with the fungus Cryptococcus, either C. neoformans or C. gaddii, I'm not sure if I'm saying that right, is called cryptococcosis. Coccosis. It affects the lungs or the central nervous system, the brain and spinal cord. Brain infections due to the fungus Cryptococcus are called cryptococcal meningitis. Very good. C. neoformans infections are extremely rare in people who are otherwise healthy. Most cases of C. neoforman infection occur in people who have weakened immune systems, particularly those who have advanced HIV or AIDS. And C. neoformans infections are not contagious. Question 9. Which of the following precautions should be used for a patient who is immunocompromised and suspected of having cryptococcal meningitis? Very good. And, the reason I wanted to do that case study is because I didn't just want to ask you this question. I wanted us to have a little bit of background before going into it. But yes, the correct answer is standard precautions for family and staff, because we looked at where the fungus can be found and how you can come into contact with it. Remember, it always boils down to what they want you to know. Do you know what these diseases are? And if this patient comes into your facility, do you know the appropriate isolation precautions that they need to be placed on? That's what a lot of your questions will boil down to. So standard precautions for family and staff. And the rationale is cryptococcosis or cryptococcal disease is a potentially fatal fungal disease caused by one of two species, C. neoformans or C. gaddii. Cryptococcal meningitis is believed to result from dissemination of the fungus from either an observed or unappreciated pulmonary infection. Fungal meningitis is not transmitted from person to person and requires the use of standard precautions. And that is the key. You have to know what the pathogen is, how you come into contact with it, and what kind of isolation precautions. I can literally ask you that question about any pathogen in that book, and they expect you to know it. So, next question. Statistical process, and we have to put a pep in our step because we're getting close to the hour here. Statistical process control charts are used for all of the following purposes except A, to eliminate natural variation, B, to monitor outcomes, C, to facilitate the determination of variation, and D, to monitor the process of care. SPC. Okay, we have a variety of answers. We have A's, D's, C's, and B's. This is not a chapter you guys know very well. That's okay. You can't know every chapter super well, right? Unless you have a photographic memory, then there's no excuse. Okay, so it's to eliminate natural variation. And what really helped me when it came to these chapters on charts is to have them pictured in my brain so that I kind of knew what I was looking at. The control chart is a graph used to study how a process changes over time. Data are plotted in time order. A control chart always has a central line for the average and an upper limit for the upper control limit and a lower line for the and a lower line for the lower control limit. These lines are determined from historical data by comparing current data to these lines. You can draw conclusions about whether the process variation is consistent or is unpredictable. SPC charts indicate the presence of variation, but do not eliminate it. Okay, question 11. Which of the following statements are true of tests with a higher sensitivity than specificity? And this can get confusing, so I'll just let you guys read it. Okay, the correct answer is 2 and 4. Patients may require further testing, and there will be a higher rate of false positives. We're not going to go through this question. We've done it before, so I'll leave the rationale here for you guys to review. This is just to give you an idea on what concepts you're doing well in and what things you might need to go back and review. 12. Regarding ice machines in healthcare facilities, which of the following is the most highly recommended practice? Do not store pharmaceuticals or medical solutions on ice intended for consumption. Do not handle ice directly by hand and wash hands before obtaining ice. Clean, disinfect, and maintain ice storage chests on a regular basis. D. Machines that dispense ice are preferred to those that require ice to be removed from bins or chests with a scoop. Regarding the ice machines in healthcare facilities, which of the following is the most highly recommended practice? Most highly. Okay, wait a minute. Okay, listen. It was supposed to tell you the correct answer is A. Ice that is intended for consumption is not sterile and most likely contains microbes that can potentially cause infection, especially if they contaminate pharmaceuticals or medical solutions. Even small number of microbes can cause serious infection if directly inhaled or injected into the bloodstream. Therefore, sterile ice or specially manufactured chilling equipment should be used instead to store pharmaceuticals or medical solutions intended for consumption. And once again, we have that handy dandy document from the CDC, the Guidelines for Environmental Infection Control in Healthcare Facilities. And so what you need to realize is that they're asking you, a lot of the times the questions are going to be like, which one is the most highly recommended practice? Which of the following would you do first? And this is how they get you. Because do not handle ice directly by hand and wash hands before obtaining ice. I mean, yeah, you shouldn't do that. So like it's basically all of these other ones are correct, but it's asking you for the most highly recommended practice. So you need to think which one of these is going to have the highest impact on your possible patient population. So you need to find ways to reframe these questions when you're taking the test so that you don't let them trick you, okay? Because you guys are all beautiful, intelligent people, and you can pass this test. Question 13. An example of a selective media. This is straight from the APIC text. Don't say loose. You always ask us about media. Why do we need to know? Because it's on the test. That's why you need to know it. Okay, an example of selective media that inhibits gram-positive bacteria is Saburad agar, chocolate agar, tryptic soy agar, McConkey's agar. It inhibits gram-positive bacteria. So think of all of these ones up here. Which one do you know you use when you're trying to get down to the bottom of a gram-negative bacteria? Which one would you use in the lab? And we don't have all day. So The correct answer is McConkey's agar. We have 2 more questions, so let's do our other 2 questions. Selective media include a chemical component that inhibits the growth of some microbes. An example of a medium that is selective for gram-negative bacteria is McConkey's agar, which contains crystal violet and bile salts to inhibit the growth of gram-positive bacteria. Don't tell me I didn't tell you this. I did tell you this. We went over it when we looked at chapter 24. Remember, McConkey's agar was the one with the pink and the yellow? What is McConkey's agar looking at? Right? It's looking at gram-negative bacteria, but what is it trying to differentiate between those bacteria? There's something specifically that McConkey's is looking for. It starts with an L. Yes, Stephanie. Yes, yes, girl. Yes. Lactose fermentation. Queens. Okay, question 14. A frequency polygon. 1. Is useful for showing 2 sets of data on a single graph. 2. Uses bars. 3. Uses lines and points. 4. Uses a histogram. 5. Can show 2, 3, or 4 sets of data on a single graph. Bada bing, bada boom. This is from your favorite chapter. This is from everyone's favorite chapter, which I've told you 500 times. I've told you 500 times this chapter is going to be on the test. I tell you all the time. I say you need to make sure you know chapter 13. You're going to get lots of questions from chapter 13, right? 1, 3, and 4. Our group member spotlight for today, so that we can end our day on a wonderful note, is Miss Amanda Vincent, MPH. Shout out to Lee County. Hey, I used to work in Naples, so I used to work in Collier County, so I was your neighbor for a minute. So her education, she got her BA in biological anthropology at Agnes Scott College. Her MPH from Emory University. Okay, high class. Very nice. She's engaged and she's getting married in December. So congratulations, Amanda. That's awesome. She adopted a derpy but sweet black Labrador retriever named Piper in April from the Labrador Retriever Rescue of Florida. And here we have Piper's beautiful face gracing our study group today. And then her hobbies are reading, travel, pure bar, and dogs. And I approve of all of those. Perfect. So our week 11 assignments are chapters 110, pharmacy services, and chapter 113, waste management. Now you guys are thinking, Luz, you typically give us 4 chapters or 5 chapters. Listen, you guys need to review. The practice exam 2 is coming up in a week. So if there are concepts that you are not feeling comfortable with still, go back and review it. If you still don't feel comfortable with chapter 13, try to read over it this weekend. I know it's overwhelming, but we are going at a pretty reasonable pace so that you're able to try to keep up as best as you can as you're preparing for this exam, okay? Does anybody have any questions for me before we go? No? Okay. All right, guys. Well, thank you so much for joining me today. I hope you guys learned a little bit today and that you enjoyed all the questions. We will be back to our regular scheduled programming next Friday with questions and also, chapter review. I just wanted to, get everybody ready for some questions. Bye, everyone. You have a good weekend too, Melody. You too, Liza. Have a good weekend. Bye.